Hi, it's Fred Page. This is part 2 of my head and toe assessment. I am doing the head, eyes, ears, nose, and throat in this section. I'm going to start by, hi, Fred Page, nurse practitioner. I'm going to be examining you a little further. Is there anything else I need to know about for the section I'm about to do now? Anything? No. Okay, alrighty. I'm going to start by inspecting his skin. It appears to be warm and dry. There's no, in the parsu, the tugger is non-tinting, as well as the texture is smooth, and his temperature is warm. Also, too, I'm going to proceed to his hair. The texture, the distribution, far as any presence of lesions. There's no, far as it's evenly distributed. There's no masses. Are lesions present, or parasites. Then, far as also to his quantity is evenly distributed across his head. Next, I'm going to move to far as his nails. His nails, I'm inspecting them, and I'm palpating them as well. His capillary refill is within 2 seconds, and also too, the color is consistent, and the texture. And there's no clubbing present as well. Okay, rest your hand down. Next, I'm going to go into palpating his head. I'm going to touch your head more. And I'm going to start with palpation of his head and down to his sinuses. And also too, I'm going to palpate as far as any presence to his jaw. Is there any presence of TMJ? Okay. Next, I'm going to palpate and auscultate his neck, and in consideration of his neck veins as well. And also too, I'm going to do the temporal arteries. And so basically, I'm going to start out by pressing here in front of the ears and down, palpating. And I'm going to, let's see, feel for a pulse. So therefore, I'm going to take my stethoscope and I'm going to listen to where I just felt for a pulse. I'm going to use the bell. That's the left side. And now I'm going to take the bell and listen to the right side. Okay. And then next, I'm going to palpate the neck further down. I'm going to palpate the neck and far as his trachea and to his throat. Let's fill in the thyroid. And then I'm going to identify the lymph nodes, the preauricular, preauricular here, posterior auricular, occipital, tonsillary, deep cervical, posterior cervical chain, supraclavicular, and submembulary and submental. Those are my lymph nodes that are present. And then I'm going to proceed with inspection of his eyes. I'm going to inspect his eyebrows, his eyelids, as well as his eyelashes and orbital areas, and also to his lacrimal, his orbital areas, and his lacrimal glands. Those are the components of the eyes that I'm going to be examining and examine them now. There's nothing as far as inspection wise is present, and I'm going to palpate the orbital area. Okay, and also too, I will point to note that his sclera is white and his conjunctiva is clear. Next, I'm going to proceed with while I'm on the eyes, I want to proceed with a direct and consensual response. So I'm going to take my ophthalmoscope and with his left eye, I'm going to zoom in at a 15-degree angle. And I'm going to do that for the other eye as well. With his right eye, I'm going to zoom in. Okay. And then I'm going to take the pen light and I'm going to, and just so you know, I'm going to shine a light in your eye, okay? All right. I'm shining the light, looking for the direct response. And also too, I'm shining it here to look for the other eye to constrict. And it does. Then next I'm going to do switch it over from ophthalmoscope to my otoscope. And this, with the otoscope, I will perform my ear examination. First, I'm going to inspect the ear. I'm going to inspect the ear, and I'm going to inspect the outer part of the ear, and then I'm going to use my otoscope. I'm going to, with the adult, I'm going to, since I'm looking into his left ear, I'm going to hold this into my left hand, and I'm going to hold it like this, and hold this out, so therefore it will not jab. Sorry. And then I'm going to pull up, look inside the ear. I'm looking all the way down. Okay. And then I will look into the other eye. While I'm looking into the ear, I'm looking for down past it to make sure there's no presence of any wax, discharge, or any type of swelling. And there's not present in the left ear. And then look into the right ear. I will do the same thing. I will hold this in my right hand. I look and inspect the outer ear. There's no abnormalities, no deviation, nothing present. And I'll do the same thing. I'm going to pull the pinna up, and then I'm looking for any presence of any wax, discharge, or any swelling, and all the way down to tympanic membrane. Okay, all right. And then next, I'm going to move to the nose. I'm expecting the external, well, the outside of the nose. The shape is symmetrical. The color, there's no edema present. And then I'm going to use my otoscope as well. I'm going to, also to the outside of the nose, there's no presence of any lesions in any irregularities present at all. And therefore, I'm going to look inside with his nose with the otoscope. I'm going to see, is there any presence I'm looking inside of his nose. There's his And I'm looking inside to his nose, into the sinus area for any edema or anything like that. None is present. As well as I'm looking through far as the nasal cavity and the nares. I don't see any discharge or any type of drainage. Uh, Next, I'm going to move along to inspect the lips, and I'm going to ask you a question. And I'm going to ask you, what year is it?
2024.
And there's no abnormalities when his mouth move or his lips move at all. And also, too, I'm going to ask you to open your mouth, and I'm notice his teeth. Say, smile for you. His teeth, and there's no mouth odor present. Now I'm going to take a light, and I'm going to look into his mouth, into the buccal mucosa area, and there's no presence of any type of edema or anything like that. There's no, the color is appropriate, it's pink, and there's no ulcerations or lesions present, or no tumors. Next, I'm going to have you stick your tongue out for me. And the tongue is actually pink, it's moist, it's shiny, and it's smooth. And there's no lesions present as well. And also, too, I'm going to ask you to open, say ah, and touch your tongue with the top of your mouth and the floor of his mouth. I'm inspecting it for the color, the texture, and there's no presence of any lesions or any sores or any redness or irritation. Okay. That concludes my head and toe assessment part 2. Thank you.